Welcome to Bad Dog Agility, a podcast helping you reach all of your dog agility goals. Whether it's competing under the bright lights of the televised finals at Westminster or successfully navigating a homemade course in your own backyard, we'll bring you training tips, interviews, and news about the great sport of dog agility. Are you ready?
I'm ready.
I'm ready.
I'm ready.
The show starts with your hosts, Jennifer, Esteban, and Sarah.
I'm Esteban.
And I'm Sarah, and this is episode 340. Today's podcast is brought to you by St. Rocco's Treats.
It's Grace from Hounds of Hack. It's Amber from American Canine Country.
It's Cynthia from CH Dog Agility.
It's Lindsay from Y2 Canines. And we love using St. Rocco's Treats as our high
Value reward.
And you will too. Visit us at strocco'streats.shop and use the code BD30 for 30% off your first order. Enjoy the attention-grabbing flavor and easy-to-break texture that Grace, Amber, Cynthia, Lindsay, and so many others love about St. Rocco's Treats. Again, use the code BD30 for 30% off. Thank you.
And you can find a link to St. Rocco's Treats on the show notes page. Today we are joined by veterinarian, vet to our dogs, godmother to our children, Dr. Brittany Schaezler. Welcome back to the podcast, Brittany.
Thank you.
Brittany was in town. She actually moved away from us, so she's no longer our dog's vet, still our children's godmother. And we wanted to talk to her today about health clearances. And I think this will be really great for especially newcomers to the sport who may not be familiar with all of the standard health clearances that we do on our agility dogs. And this will give them an idea of what those are, why we do them, what they're for, that kind of thing. So, Brittany, let's just start off by asking a very loaded question, I suppose, which is, what clearances are important for an agility dog?
So clearance really, or what clearances are important really depends on what breed you have. Because some breeds are more prone to certain diseases than others. But in general, for a dog that is doing performance sports, I think hips are really important. I think elbows are pretty important. Eyes are important. And then you start to get into things like heart, knees, like patellas. You know, those can be a little more breed specific, but obviously those are important things for agility dogs as well.
And so when we're talking about clearances, a lot of times a person who's new to the sport, their first introduction to this idea is going to be from their breeder. If they get their dog from a breeder, the breeder, number one, will have done some number of health clearances on the dogs in their breeding program. And number two, the breeder may require the person getting the puppy to do clearances on their own dog. So how important are these clearances from a breeding standpoint? Like, what are they telling us? When we say that we're going to do clearances on hips, what is that telling us that's useful information, both from the breeder side, but also from, this is my dog, I'm not going to breed it, and why do I care about how my dog's hips look on x-ray?
Okay, so specifically with hips, certain breeds are more prone to hip dysplasia. So breeds like German Shepherds, maybe Labradors, but generally large breed dogs. A breeder is going to, so when you're getting a puppy from a breeder, you want that breeder to have checked for hip dysplasia because you want to decrease your risk that the puppy you are getting is going to have hip dysplasia. There are no guarantees. You can breed two dogs with excellent hips and get a dysplastic puppy. But hip dysplasia is a complicated disease. There's a lot of genes involved. It is not a simple inheritance. So you can do everything right and still get a puppy with hip dysplasia. Your breeder can do everything right and still produce puppies with hip dysplasia, but you're just trying to decrease the odds that that happens. So if you have honestly, really to me, almost any breed that if you want to do agility, you should check hips and know what you've got there. And as a breeder, you want any puppy you produce out there to also be checked, whether they're going to be bred or not, so you know what you're producing. Because if you produce 8 puppies and the only one that gets checked is the one you keep as a breeder and it looks fine, you have no idea if 6 of the other puppies are dysplastic unless the owners of those dogs are also going and checking.
All right, so let's talk about, just take them one by one from the common ones that we talked about. So hips is basically checking for hip dysplasia. What are the elbow clearances looking for?
You're looking for elbow dysplasia, but elbow dysplasia is a group of diseases that affect the elbows that can cause basically arthritis at an earlier age in those elbows. It can affect range of motion, can cause pain, can lead to lameness. So there's multiple things that are under the group of elbow dysplasia, like fragmented medial coronoid process, ununited ankylosing process. Like, it doesn't matter the specific problem. They're all kind of lumped under elbow dysplasia. Hips, there's actually two different ways to check hips. So there's your kind of OFA hips, which is where you take one x-ray of a dog laying on their back extended, and you kind of see, is the socket of the hip in place? Is there any changes? Like, does the head of the femur sit well in the little cup there so that like it's not going to pop out? And then there's also pen hip, which is a different way to assess hips. And that is where there's multiple x-rays taken and you are measuring angles of distraction. So basically, how loose is that hip in the socket? And then each breed has a range of normals for each specific x-ray that you're taking in each distraction. So like, you're always comparing when you're looking at OFA scores of like excellent or good, or if you're looking at pen hip scores, you are comparing your breed to other dogs of your breed. So an excellent German Shepherd is going to look different than an excellent Sheltie.
Got it. And then what about eyes? What are the types of things that we're looking for when we do eye checks?
So the eye exam is looking for hereditary eye diseases. So things like cataracts, or some types of cataracts, PRA, which is progressive retinal atrophy, signs of glaucoma, things like that could be inherited. One thing that an eye exam cannot tell you is if the dog is going to have or pass on ETO.
That's right. Yeah. So we talked a little bit about that in our ETO podcast, and I'll put a link to that in the show notes. But while ETO is associated with vision, it's not like a simple test. So this particular, I guess the exam that everybody typically does for their agility dogs is not really going to catch it. And I don't think that there is a, exact singular test that says, yes, you have it and no, you don't.
No, there are some more specific eye tests like retinoscopy, but even those can't catch every case of ETO or tell you if it's going to be inherited.
And for people who don't know what ETO is,
yes. So that would, ETO is early takeoff. So we have 2 podcasts about that I will link to in the show notes page. And then can you give us an example of like a breed specific clearance that should definitely be done for one breed, but might not matter for a whole bunch of others? Like, what is just an example of something people might hear or see, or if they have that breed?
Sure. So like one that's actually probably fairly common in a lot of breeds you see in agility would be patellas. So a patella exam is where a vet feels the knees and decides if their patella luxates or not. So there are a lot of breeds where that is super common. Some of those are going to be breeds you see in agility, but it's real common in small breed and toy breed dogs. So it's really common to see a Yorkie with luxating patellas. It is really uncommon to see a Labrador with luxating patellas. So, if I had one of those breeds or one of those small breeds, I would absolutely want the patellas to have been checked and certified. I really don't care if I have a lab that hasn't had a patella certification.
Awesome. And now for people who, maybe they're new to health clearances, how do they know which are the right ones to get for their dog? How do they know that they're doing the right thing for an agility dog?
So every breed club is going to have a website. Whatever your breed is, you can Google it. And somewhere on that website, they're going to have a list of health clearances that they recommend for breeders. So those are going to be the diseases that are most common in that breed. So every breed's going to have their own little nuances. But that is the best place to know like what information you should be looking for in a breeder, when you're getting a puppy, and also what you should be considering testing for in your own dog to kind of try to make sure they're as healthy as possible.
And for people who have mixed breed dogs, would you just recommend like if going to the breed that is most similar or kind of just doing the big ones like hips, elbows, and eyes?
I think most similar is reasonable. I think hips, elbows, eyes is always a good place to start. If I had a small breed dog, I definitely would also look at knees or patellas, just because we see luxating patellas so much more commonly in small breed dogs in general. Looking at things like hearts and things like that is really going to depend more on what specific breed mix you might have.
Okay. And so then how do people get these clearances? Like, where do they go? Can you do most of these with your vet? Do you have to go to a specialist? What's the difference between like testing versus certification?
So most of these can be done by your regular vet. If your vet does them. So like I know some vets who don't want to deal with sending x-rays to OFA, and that's fine. That's an extra step. But in general, hips and elbows are going to be a sedated x-ray. So I personally believe that to have good results, you need to have a sedated patient. So that they're relaxed, so that we know that everything is positioned correctly. When I do my own dogs, I sedate them, even though they're very good and can be positioned pretty well. So those are just going to be a couple of standard x-ray views. If you want to get your dog pen hip certified, which is kind of a more specialized exam that can be done in a younger dog, that's going to require a vet to have some special education to know how to get those views and take those views. So you're going to have to find a more specific vet for that, and Pen Hip on their website lists what vets do that. For eyes, you need to see a board certified veterinary ophthalmologist. So you will make an appointment with an ophthalmologist. They will dilate the eyes. They're going to do their full exam, and they will fill out the paperwork for you. And then usually you have to submit it. So, and then hearts, you're generally going to go see a cardiologist. The heart certification can be as simple as a cardiologist listened to your dog and did not hear a murmur, or it can be as complex as a cardiologist actually does an echocardiogram on your dog and does an ultrasound of their heart and sees what's going on. So in terms of testing versus certification, most testing is going to go to OFA, which is the Orthopedic Foundation for Animals. So they have a database. You can access it online where they keep track of all health testing that is submitted for each individual dog. So whatever your dog's registration number is, it's going to have whatever clearances you submit. When you submit some information to OFA, it is going to involve a review. So if you send your x-rays to OFA, 3 radiologists are going to look at the x-rays and give you a score. Excellent, good, fair, or dysplastic. And they actually review those. They review elbows. Other information, so your eye exam that was done by a veterinary ophthalmologist, you are actually submitting the form. The ophthalmologist has already done the exam. You're just submitting the exam form to them for them to record. So OFA actually has reviews of some health information, and other they're just recording.
Got it. And so like, especially for the x-ray based stuff, and you can correct me if I'm wrong, I don't want to put words in your mouth, but I guess my experience over years has been that when you're submitting to OFA, like when you say grade it, you're going to get a result that might be like excellent or good or fair, or what are the others? Bad?
There's dysplastic, and there's different levels of dysplastic, right. I believe.
And so it's kind of been my experience that your regular vet just kind of taking the first look at the x-ray might be able to say, okay, these look bad or these look pretty good, but it's kind of almost like binary. Like this looks pretty good, this looks, bad. Whereas you're going to get like the like grading with, like you said, 3 radiologists agreeing or at least averaging their results to give you like, what's the difference between good and excellent?
Yeah. So if you're not breeding, and potentially even if you are breeding, the difference between good and excellent is not really significant. Like that's a dog with good hips. If you're not breeding, you don't care if your dog is going to grade excellent or good. Elbows are a lot trickier to read. And so I always send my elbow x-rays in because just as a vet, like elbow x-rays are like tiny things can be significant. So I always send my elbows because I want a radiologist to look at them. Hips, if the hips look fine, like I look at hips every day. Most vets do. Like it's a common x-ray, and hip dysplasia is not subtle. So, if you want a grade, send it in. But if you just want to know if your dog looks great for agility, your vet can probably look at that and say, yeah, these are fine. I don't see any problems. If you really want that information, you can always submit those x-rays to OFA though.
Perfect. And now let's talk about what age you should get them done. And I guess one other thing to touch on that's kind of related to that is that some of these are like one and done. Like you do it and that is like you do hips and that is your dog's score for hips forever, right? Whereas aren't some of them like something that you might do yearly, like eyes or something like that?
Right. So eye exams are something that if you're breeding, you do yearly, because things can change over time. They're looking for hereditary problems, but still, like there's certain things you would not expect to pop up in a 4 or 5 year old dog, so if you do it at 2, you still want to continue to track if you're going to continue to breed that dog. Hips, yes. So you can get a preliminary OFA hip score at 1, but you can't get an official score until 2.
But then once you have it, you're done because
Yes.
it's really looking at like the structure of the hips.
Right. Your hip dysplasia is hereditary. There's other factors, but it's hereditary. And so if your dog has great hips at 2, it is not suddenly going to have dysplastic hips at 5. One interesting thing about the pen hip certification is that you can do it in puppies as young as 16 weeks of age. So if you have a breed that is more prone to hip dysplasia and you are getting a puppy, and you want to know if that puppy is going to be suitable for agility, that may give you more information sooner than having to wait until a year or 2 to take kind of the standard OFA x-ray.
Got it. All right. And then the last thing that I wanted to cover is now that we've done the clearance, we've gotten the result, and what does the result mean for your future in the sport? So, I guess I feel like it's pretty intuitive that if your results are good, then everything's fine. But if your results are not what you expected or hoped for, and you're not planning on breeding, so it's not a matter of passing it on, then, what are the kinds of things that matter for our sport and how are they going to manifest? And what do we do with the knowledge that we gain from the clearance?
Well, there's certainly things that if you find something like juvenile cataracts in your young dog, that is obviously going to be career shortening and limiting in an agility dog. Like they are going to lose their ability to see well. With something like hip dysplasia, it's a little bit more complicated because I have seen many dogs that did not get hip x-rays when they were young. Now they're 8 or 9 and they're suddenly starting to struggle to jump a little more. Maybe they're dropping more bars. Maybe they're like struggling to jump up on the sofa at home. And now we take x-rays and they have severe hip dysplasia and arthritis. We know they've had hip dysplasia for years, and yet maybe they've successfully had a successful agility career to that point. So if you know at a younger age that your dog has issues, then it doesn't mean they can't compete in agility. It doesn't mean that that they have no future in the sport. It may limit their future. They may struggle more, but I've just seen it happen specifically with hips where they just compensate for a really long time and don't seem to have any issues until they do. Elbows, I feel like, are a little bit more limiting because there's so much impact on the front end when they land. Their entire body weight is landing on their front end. And so that impact and jumping over time, I think, is more likely to cause issues long term. Hips is the one where I would, like, if I got a dog that came back fair, I'm probably going to work really hard to keep that dog lean, keep them well muscled, watch them really carefully, but it doesn't mean they're not going to be able to compete in the sport. One thing about getting preliminary x-rays done at 1 year of age is that is a really good time to check growth plates. So I always prelim my dogs right around 1, because it lets you check the proximal tibia that shows up in kind of your standard hip x-ray. And that is one of the last growth plates in the long bones to close. So if I take that x-ray and I see that growth plate is closed, then I feel comfortable starting to move my dog up in jump height.
All right. Well, that is it for this week's podcast. Thank you so much for joining us again, Brittany.
Thank you for having me.
We'd like to thank our sponsors, St. Rocco's Treats and hititboard.com. Check out the Teeter Teach It, only at hititboard.com. The Teeter Teach It is an easy-to-use tool that controls the amount of tip on your teeter so you can introduce motion to your dog in a gradual way. Go to hititboard.com for the new Teeter Teach It and other training tools and toys. Use discount code BDA10 to get 10% off your order. That's hititboard.com. Happy training!
Thank you for listening to Bad Dog Agility. We hope you enjoyed today's episode. For more information, updates, and links to all our socials, just check out our website, www.baddogagility.com. If you haven't already signed up for our email subscription, we would love to have you join the BDA community. Until next time, take care.
Why shouldn't you play games with big cats? Because sometimes they're cheetahs.